Medically Speaking with Dr. Virginia Kane, where public health issues are discussed and designed to promote wellness by encouraging healthy behaviors, by gaining insight and awareness on how public health affects the health of our community.
Hello, and welcome to Medically Speaking. I am your host, Dr. Virginia Kane, Director and Chief Medical Officer of the Marion County Public Health Department. Each week, it is my pleasure to host Medically Speaking and bring you the most current, up-to-date information regarding the health of our community. In today's segment of Medically Speaking, we're going to talk about the role the Fairbanks School of Public Health has contributed to addressing the COVID-19 pandemic. The Richard M. Fairbanks School of Public Health has been a tremendous asset to the Marion County Public Health Department in providing guidance in contact tracing. Contact tracing is a little like detective work. Trained staff interview people who have diagnosed with COVID-19 to figure out who they may have recently been in contact. Then they go tell those people they may have been exposed, sometimes encouraging them to quarantine themselves to prevent spreading the disease any further. Think of it as part public health work and part investigation. Contact tracing helps keep the population safe while getting care for those who need it by tracing them through the COVID-19 recovery process. Joining me now is Dr. Paul Haverson, founding dean of the Indiana University Richard M. Fairbanks School of Public Health. Stay tuned for Medically Speaking with me, Dr. Virginia Kane. Welcome back. We are very fortunate to have the Fairbanks School of Public Health, and especially to have Dean Haverson as the founding dean. So, Dean Haverson, tell me about the school and why Indiana needed a school of public health.
Thank you, Dr. Kane. It's a wonderful delight to be with you, and thank you for all the great work that you do on our behalf here in Marion County. As the founding dean at the School of Public Health, it's been my privilege and my honor to begin that process of having the School of Public Health be a resource for Marion County and for our state of Indiana. I guess the question around how and why do we need a School of Public Health is sort of rooted in the fact that we have some real challenges here in Indiana from a health perspective. I'm a Hoosier by choice. I love being in Indiana. But you know, we've had a substantial struggle with our health status over the years, and in fact, we're still ranked now number 41 in terms of our overall health status. And in areas like tobacco, we're at 44, and believe it or not, we rank 49th out of 50 states when it comes to our per capita funding of public health. And so, as a challenge to our health system, we really have not had the resource here in the state to provide support to the state and local health departments, nor to really train the public health practitioners to be available to provide support in terms of the workforce for public health. So the School of Public Health is really all about providing that support and creating the research and doing the work that helps to improve and protect the health of the public. In essence, we're a support system to you as a health director, and we take that role very seriously and very pleased to do that.
So, how has the Fairbanks School been involved with the pandemic?
Well, thank you for asking. And you know, there's an awful lot that we've been doing, and we're so pleased to be able to support. First of all, I think probably 3 or 4 different aspects of our work. We started working actually to support Marion County and of course the Marion County Public Health Department, but also to work with the hospitals within Marion County and then ultimately throughout the state looking at helping them as they were beginning their ramping up to be of service to their communities in terms of modeling and capacity planning. So that was a big part of what we did. And we have some incredible informatics people that have been involved with monitoring the day-to-day statistics and the capacity of our hospitals. Secondly, we've been involved in helping to support the state in a really important first ever in the country random sample prevalence study for the disease, both current infection as well as antibodies. Secondly, or thirdly, we've been working with the health department, particularly with the Marion County Health Department, in terms of the work that you've been doing as you've been gearing up to help bring schools back and universities, and also to support you in your efforts with the public health orders. So those are two or three things that I think have been pretty important for us. And then we've also been involved with, of course, the contact tracing, as you mentioned earlier on. And we're so excited about beginning to actually be a support to the Marion County Health Department in supporting the contact tracing, which we know is just a critical element as it relates to being able to box in this disease. And so those are, I think, 4 different areas that we've been pretty involved with. And I couldn't be more proud of my faculty and staff as they've really come together to support our county and our state in this pandemic response.
So, Dean Harrison, can you describe how Fairbanks has worked to support our Marion County hospitals?
Yes. Well, thank you, Dr. Kane, because in terms of the hospitals, a big part of that effort has been helping them as they are monitoring the extent of the disease, their capacity. Early on, health officers at the county and the state level asked our hospitals to step to the plate to be able to provide additional capacity. And I would, again, say how pleased and proud I am of our hospitals, because they actually did a great job in bringing on additional capacity, finding additional ventilators, allocating additional ICU beds to the effort. And we were asked to help them to keep track of the number of patients that were coming in, the anticipation of patients based upon disease, and the potential for overloading the system, because the last thing anyone wanted was to have more patients than we had resources. And so that modeling was so important to the hospitals. And then from a public health system perspective, as you know, as we sat together many, many days looking at the capacity of our hospitals, and I want to say how pleased I was to work with each of the chief executives and the chief medical officers in these hospitals, because they work together so well, sharing information. The state health department put together a database that kept being updated. And of course, our mesh organization here in Marion County was so crucial in maintaining every day, actually 3 or 4 times a day, the capacity of our Marion County hospitals. And so part of what we did was to help bring all that together and creating some dashboard tools and being able to give the hospital decision makers, as well as yourself and others, a picture of where we've come from and where we're going, so as to anticipate the load and make appropriate preparations.
So thank you. So can you describe your school's work in the statewide random testing that took place not too long ago?
Well, that's really important, Dr. Kane, because, again, as I mentioned, we were the only state actually in the country and the very first state to conduct a random sample testing. When we were doing testing for clinical patients, initially, as you may remember, only the sickest patients were being tested as the tests were not very readily available. And so we had a sense of the cases, but we really didn't understand the extent of the disease. And so again, with Governor Holcomb's strong support and the concurrence and direction of Dr. Box, our state health commissioner, we worked to develop with a lot of partners the opportunity to do a random sample of the entire population of Indiana. And we did that with everybody working together to actually draw the random sample. And then we're going to be going out into the field and 4 times during this year. We've already gone twice, but 4 times during the year, we'll be actually monitoring not just the people who are sick, but if we look at a random sample of people, then we can actually estimate the extent to which people actually have the disease. And what we found generally was around a 2.8% of the people either had the current disease or had antibodies for the disease. And we were able to estimate that about 11 times the number of people who actually we knew about clinically, about 11 times more people actually had that disease. And so if we look at that, what we're seeing at the clinical level in our hospitals and clinics was just a very, very small number. Back in April, it was around 17,000 people that had confirmed disease. But what we knew on the basis of the random sample study was we had actually about 11 times more people in the state that actually had the disease, or around 188,000 people. So it gave us a sense of the extent or the magnitude of the spread of this disease. Also, it helped us to be able to understand that about 42% actually of the people that tested positive had no signs of the disease. They were asymptomatic. So that's really, really important, because we recognize that in this infectious disease, we have got a lot of people that don't even know they're infectious, and of course they can spread the disease. Thus the importance of masks and social distancing and all of those other prevention strategies. Lastly, I would say that one of the important things that we did, with your help, by the way, was to work with our minority communities. We had a population study that was done in our African American community in the churches, and then we also did something similar with the Hispanic community. And we found that, unfortunately, many of those people who worked in essential positions had substantially higher, and sometimes it was as high as 10 times a higher level of disease. And in some populations, we found that disease was almost as high as 28%. So that creates for us an understanding of the fact that while this disease has been widespread, it has been more concentrated in our minority populations. And that creates enormous challenges for those populations who have barriers to being able to be seen in the healthcare system, and who don't have the luxury of having sick time. And so when they're sick, they tend to go into work, and that does also create additional exposure opportunities. And so it gives us the opportunity to work in developing important messages and to work with the population to help them understand the importance of staying home when they're sick, to self-quarantine, to be tested, and to actually work towards getting the support that they need. So the random sample testing is really, really important. And over the next couple of administrations of this survey, we're also going to get a better sense of how far this disease has spread, how long the antibodies appear to be in the system, and also as we think about the fall, as you and I have talked about, I think we're going to run into yet additional peaks of the disease. And again, with the flu coming on, I think we're all very nervous about the potential for additional strain on our system. So the random sample testing has been really, really important.
So listen, Dean Havison, we're going to just take a short break now for our sponsors, and we'll be able to come back to Medically Speaking. All right, we're back. with Medically Speaking, with our host, founding dean of the Fairbanks School of Public Health, Dr. Paul Havison. And Dr. Havison, I wanted us to really try to concentrate on contact tracing, and maybe you can describe it for the average person and why is it so important?
Well, it really, really is important in large part because of what we said earlier about the fact that sometimes people are infectious and they don't even know that they have the disease. And so the fact of the matter is when a person is tested to be positive, then it's really important to figure out maybe who they've been around. And so this contact tracing, we want to look to see in this disease, the idea would be to identify those people that may have been around a person that's positive for longer than 15 minutes and closer than 6 feet. That's sort of the general parameter. What we want to try to identify are those people that may have inadvertently been exposed to an individual that is positive for COVID-19. And so this virus, one of the ways in which we're able to reduce the spread and what's called boxing it in is to be able to identify the people that have been around a positive person so that they can then be tested and they can self quarantine and keep themselves away from other people. So the idea is find the positive cases, find the people that were next to the people that were positive, test them, have them self-isolate, and ultimately what you do is try to isolate all the people that are positive and keep them away from in spreading that disease to others.
So, Dean Harrison, the Marion County Public Health Department has been doing contact tracing since the epidemic started. But, when we found out that we were getting as many as over 300 cases a day, for our manpower was not there in terms of being able to do everybody. So we will appreciate this partnership with you and the city of Indianapolis for providing a sufficient number of contact tracers working with all of us, the State Department of Health and the Marion County Public Health Department. So I want to just ask you these last few questions or concerns. What do you think it's going to take in order to control this coronavirus 19 pandemic in Marion County? What critical factors do we have to have in place to make that happen? What should we be doing?
Yeah, that's a great question, Dr. Kane, and I'm happy to partner with you because I know you're working really hard. And the Marion County Public Health Department has a strong reputation in being able to be a very, very effective health department, and we're happy to help support you in that effort. But number one, I think, is the prevention message. And you've done this very well, and Mayor Hogstad's been very strong leader in supporting the notion of a mandatory mask mandate. I got mandated in there a couple of times. Sorry about that, but it goes to the importance of wearing a mask. We know that we can reduce the spread of this disease by simply putting on a mask, social distancing 6 feet or more, and washing our hands, keeping our hands and the surfaces of areas around where we work and play and keeping them clean. Those are the prevention strategies which are so critical. And I know there are other strategies that we're working on with our schools and universities and businesses, and those will be very, very important. Secondly, is having access to good testing. Quick testing, accurate testing, being able to have the ability to quickly test people when they need to be tested, and where appropriate, use surveillance testing to assure that special populations are being appropriately served and protected, and that testing is really important with rapid response of the test results. And then third is just making sure that we can monitor appropriately all of the various parameters, the statistics, the testing, the people who are ill, and being able to stay on top of the informatics. And so we're so proud to work closely with our informatics faculty and the folks at the Reagan Street Institute, which have been so helpful in gathering statistics and information. And as you know, Dr. Kane, you were part of this from the very beginning, but the Indiana is very blessed to have an incredible electronic resource tying together all of our hospitals and our clinics and so forth, with being able to share data and to use that data to make wise clinical decisions and public health decisions. And now, as you and I together look at this public health data, we can be informed not by guessing, but by actually looking at good data. So having that data is important, having that guide our decision making, having strong policies that mitigate the disease and help create a prevention barrier or strategy. Those are all really, really important. And again, I also think it's crucial that we continue to work together well with our state health department and with our governor as we have. And it's been wonderful to see the leadership that you and Mayor Hogsett have provided here in Marion County. And again, Dr. Box and Governor Holcomb at the state, all of us working together to support and protect the health of the public is really what it's going to take. It's a full court press, and it's a marathon, not a sprint, as we recognize. We've been at this since February, and I know there's just so much to do. And this is the heart of public health. And I go back to where we started, which is we are in a state that has, unfortunately, poor health. We're ranked towards the bottom of the list in terms of health, and we have probably one of the worst funded public health systems in the country. And I'm so heartened to hear the importance that Governor Holcomb and legislators are beginning to talk about what they need to do to support public health in our state. And I'm so glad to hear that. And I'm also so heartened to hear that, that Mayor Hogsett continues to be such a strong and strident supporter of the Marion County Public Health Department. And your leadership has been very, very important as well. So again, we appreciate working with you, and we know that there's so much more to do, and we look forward to doing it with you.
So Paul, this is the last question.
All right.
That's the toughest question of all the questions I've asked you today. And we get this query a lot in terms of why do we allow contact sports to take place in our high schools and middle schools? What's different about them than college students or professional sports in terms of like the transmissibility?
Well, and that's a really important point, Dr. Kane. We look at the data very carefully, as you know, and we can see the proportionality of disease by age bands, and we look specifically at this group between 0 and 29 years, and we can see very, very small amount of prevalence of disease in our 0 to 10, and then it goes up a little bit in that 10 to 15, and then into our high school we're more, but certainly not nearly what we are when we get to the 18 to 24 range. So the point, I guess, is the disease is not spreading nearly at the level in our high schools as it is in our colleges. So that's the first part, which is the spread of the disease. Secondly, we know that there is a greater degree of containment within the high school environment. We've got kids living at home for the most part, and they have very strong rules and protections. And again, as we've talked with the Athletic Association and the athletic directors and coaches, it's really clear they are very serious about protecting their athletes and prescribing the behavior of athletes and families and contacts, and the approach that you've taken towards putting limits on spectators and crowding around athletes and so forth and so on. All of those things contribute to allowing us to have a better sense of the safety of this. In as much as the fact that it is a contact sport, it is not without some degree of danger, but it's certainly, in our view, not nearly the level of exposure that our college students would have, and certainly our professional athletes. They first of all have a higher transmissibility. Secondly, they're in not nearly the level of controlled environment. And third, it's just a different environment that we see in that age group. So The other thing, as you know, we're going to be watching this very, very carefully. And if in fact this disease percolates up, I think I don't want to, it's your decision, but I've heard you say we're not going to take chances on our kids. If we see the disease going up, we'll need to curtail. So I feel like we got a handle on it, and I believe this is an appropriate risk, with the benefit being to our kids in particular, who really need to have that ability to have something to do in an organized way, and to do so in athletics is, I think, really important.
So listen, thank you, Dean Havison. We've just appreciated having you on our show, and I think all of our viewers have learned some remarkable and very helpful information. So thank you again.
Thank you, Dr.
I appreciate it.
Thank you, Dr. Kane. Appreciate your leadership. Thanks for the opportunity.
Good. So thank everybody for joining us today. Hopefully we've been providing you with some very important information to keep you and your family safe. I am Dr. Virginia Kane, host of Medically Speaking. Be safe and careful out there.